Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hi, I'm Suzie. I am a clinical operations manager or a COM in the NN3 team in North Place, and we do community nursing and therapy.
So describe the team that you work with.
My team are amazing. So I have a mixture of registered nurses, registered therapists, so physios and OTs, amazing healthcare assistants, nursing associates, assistant practitioners in therapy, so a real MDT. And they're wonderful. They're amazing people. They go and see patients predominantly within their own homes, and they deliver a whole range of things, whatever those patients need: wound care, rehabilitation, exercises, education, support, lots of stuff, but all in the patient's own home, and always in the pursuit of keeping that patient in their own home for as long as possible and keeping them as well as possible.
Yeah, I mean it's a fundamental part of NCHC, isn't it? Our community nursing, and we know that we've got offices and bases all over the place. So do you work closely with any other like geographical bases? Do you feel that you're quite separate, or do you sort of have that collaborative working across the county?
That's an interesting question. So as a com, I feel like I work really, really closely with my kind of counterparts within the other teams. We've got 4 community nursing and therapy teams in North, and we get together twice a day to talk about our teams, where we're at in terms of staffing. We talk about anything that we're worried about, whether we're able to get to all the patients that we need to that day, and whether we need support. And our teams are amazing. The clinicians within our team will go and work in another area at short notice if they need to, if one area is particularly short and we're slightly better off on that day. So they will move, they will see patients in other areas, which I I think really has demonstrated for me the flexibility of our workforce and how much they are willing to do and put themselves out, i.e. travelling further, working with GP surgeries they're not familiar with, patients in different areas, teams they don't know, all for what our patients need, and making sure that the people with the most urgent need are seen as soon as possible.
It's a very reactive way of doing things. So I guess that must present some challenges though. And obviously like we know that staffing is a big issue across the trust at the minute. So are you feeling the hit there that, even though you might be able to lend out some nurses to another part of the organization, like you probably, I'm guessing you don't have that many to lend out yourself. So what kind of challenges are you facing at the minute?
It's interesting. So I've been doing this particular job for 7 months, and during that period it has felt that squeeze has become more and more and more, and COVID is still a factor. We've got people off sick. I think it's fair to say that staff members haven't come out of the pandemic unscathed. People are dealing with a lot of stuff. We've been through a really difficult time, and that's taken its toll on everyone. So people's resilience is perhaps not where it can be, and I'm hugely supportive of that. And I always am very conscious of that asking people to go somewhere else and work somewhere else. We do try as a North Place to be really proactive and plan our rosters well and make sure that, we've got not too many people off on annual leave at the same time. But I don't think anyone is sort of doesn't know how difficult it is at the moment with vacancies and recruiting, and therapy in particular is a real issue at the moment, recruiting to therapy posts. It's really hard. And the people who are here and are turning up and are doing a really good job are doing amazingly. But I will confess that I worry about those people. And yeah, it's hard. That's a very hard part of my job.
Yeah, of course, because you've also got things like petrol costs to contend with.
Mhm.
So when you are asking your staff to support not just their own patients, but other patients as well, that's geographically could be difficult. People are well within their rights to say no, presumably,
Absolutely. Yeah.
but also might feel like they can't because it's part of the job is that you want to help and you've got that compassion. So it's a really sort of like a rock and a hard place, really. And I suppose as a com, that's your job, isn't it? To juggle it all. How does that take its toll on you though, as like personally?
I try to do whatever I can to make it easy, and I'm lucky in my position that I do have levers that I can pull. So we do have, for example, pool cars and things like that. So if someone is having to travel extra, they can have the use of a car to cover that distance. People are always given additional time to travel, and they're given their mileage payments to cover, but appreciate that that's always in arrears. The money always has to come out of their pocket before it gets paid back. And I'd be really keen for the NHS as a whole to look at that because I think that is something that really does need improving, particularly now with the cost of fuel. It does worry me. I'm not going to lie and say that it doesn't worry me. It always, like I said, it always feels like a big ask. And I think there is something to be said about culture. I think the culture in North, there seems to be a feeling across all 4 teams that we are all in it together. We are all supportive of each other. It's not like NN3 looks after NN3. All of the NN teams are there for each other, and if they're struggling in NN4, then we want to do something to help that. And I think that speaks volumes about the leadership in Norfolk, and that we've kind of created that culture where we all want to help each other wherever we can, even if it puts us out or it stretches us a bit. And as com, and I know that my colleagues in other teams feel the same, we're here to support people in doing that and help them feel like that stretch has been worthwhile, and patients really appreciate it. We really appreciate it.
Your level of support to other people, I always think about this, that there's senior leaders and then middle leaders are always kind of looked upon as the ones to fix the problems and, you know, make sure that everything is in place and there's all the jigsaw parts are slotted together. But who's looking after you? Do you feel supported in your kind of layer of the organization?
I think sometimes I am not perhaps able to articulate what kind of support I need. That's something that I've learnt.
Do you think that's common across this kind of job role?
I think it's a real skill, and I think it's a skill that we don't often talk about. Quite often in this organisation, we hear the question, you know, are you feeling valued? Do you feel valued? And I have kind of learned over many years, and my background in coaching really helped with this. What does being valued look like? What is it that's happening? What am I seeing and what am I hearing when I'm being valued? And I think if you're able to articulate that, you then are much more likely to get what it is that you need. And I think I view support in the same way. Am I able to articulate what support I need? And I'll be honest, some days when I am really overwhelmed, I'm not able to articulate that. What I am always assured that I can do is contact someone, my line manager. The comms and clinical leads in North are really supportive and we work together really closely. I know that I could ring any of them if I was really struggling with something, didn't know where to turn to. And for me, being relatively new in post and not having done an operational leadership previously, I do that quite a lot. And it's never well, why don't you know how to do that? Well, you know, you've been in the job long enough, you should know. That has never, ever been a response. People will always help and always be supportive. But yeah, I would say the days where I am able to say really specifically, this is the difficulty that I'm having, this is the challenge that I've got, this is the support that I need from you, are the days where I feel much, much better supported. And that is as much my responsibility as it is the person that supports me. The other thing that I was just kind of reflecting on is that denial is sometimes a really useful coping mechanism. And I reflect on periods of time where I've gone, no, it's fine, I'll carry on, and think, oh, I need to carry on. And that is the thing that has seen me through the difficult time. Unfortunately, the kind of flip side of that is you do get to the point where you can't do it anymore and you crash and burn. But yeah, I recognize that a lot, and that's something that I see with everyone. It was something that I experienced, you know, as a clinician a long time ago, patients with long-term conditions, and that kind of denial, not wanting to look at that, was how they coped with something that was really, really difficult and really, really hard.
Yeah, and that's not necessarily a bad thing if it's like sustained for a long period of time and
Mm.
it means you're not really kind of accepting what's happening. It can be, I suppose. You mentioned there your background in coaching, and you also mentioned your background in clinical. So you've got a really interesting journey through the NHS, haven't you? Because so am I right with this? You started in clinical, then went to corporate support services, and now you're back in clinical. So you've kind of moved your way through. You've sort of straddled different facets of the organization, and I think that's really interesting. So this last move, what made you want to move back towards operational sort of clinical side from the service improvement partnerships team where you were working in central services?
So I was working as a project manager within support services and the kind of newly structured service improvement partnerships team, purely because I'd got to the point in that job where, in terms of my development, there was not really a lot more for me. And psychologically, I felt ready for something new and a challenge. And I was lucky enough sometimes the stars align, don't they? And there was this post within operations that would give me the opportunity to manage a budget, manage a team, learn how to use a roster, and really give my kind of coaching skills a really, really good go. And it was a secondment, it was covering maternity leave. And in the back of my mind, there's always that caveat with the secondment that you can go back. I thought, oh, good, if I'm rubbish at it, I'll be able to go back and do my old job. So I went to the interview with no expectations whatsoever. But I can honestly say I absolutely love this job. It is one of the most rewarding jobs I've ever done in my life, or is the most rewarding job I've ever done.
Have you got any transferable skills that you've learned from support services that you've been able to apply in your current role?
I think there is probably unconsciously a huge amount of project management methodology that comes through. I think it's contextualized. I think where I currently work, there is a very black and white place in project management, and I've learned that is not always appropriate. But certainly, thinking through things in kind of a much more methodical way is something that I learned to do as a project manager. That was definitely a skill that I honed, and fundamentally establishing what the problem is before we take any action. What is the problem, and are we certain that that is the problem that we need to solve? And taking a real kind of, well, having a real emphasis around scoping and, like I say, understanding the problem and making sure that we aren't putting things in place that aren't going to address the issues or change the situation positively.
I suppose having worked across all of the different facets of the organisation, there you can see how NCH&C serves the patients and then the teams and then the organisations in all those different ways, which I think a lot of people maybe don't have that perspective. And I wonder whether in support services we can really ever understand what it's like to be on the front line. Do you think that we have enough dialogue with our clinicians to really understand what people feel? We'll never have your perspective on things like that, but do you think by having conversations with people like yourself and the people who are in a similar role, that we can get more empathy and therefore more understanding?
I don't know that is ever a journey with a destination that you reach. Clinical world, operations world it's ever changing. Patients are changing, complexity is changing. The role, I mean, I've been out of clinical services for 6 years now, and it's so different to what I remember. In my coaching role, I used to have a supervisor who would say to me, stay in the not knowing. And I think what we potentially do, all of us, is have conversations with people and go, right, I understand it now. I know what goes on now. When in actual fact, we will never know. Through a conversation, you will never know. Through that conversation, you will have a snapshot. You will have how someone feels on that day about that thing. But how they feel and how they respond to it on another day may be completely different. So I suppose what I would encourage people to do who perhaps aren't working, directly with patients, is to never assume that they know. Always think, do I know? Always wonder, do I know? Could I know more? I'll ask again. And I worked in support services, having been a clinician for many years. I've worked for the NHS for 20 years now in a variety of clinical roles, and I worked in support services thinking I have an understanding. I've lived it, I've breathed it. I didn't. It was different. People's experience, people's lives, what's expected of them, it's all changed. And I suppose what I've learned now is to, like I say, stay in that not knowing. Yes, I've had that conversation with someone, but I'm going to go back and have another one on today and see if it's the same and see if it's different.
Well, yeah, because it's a moment in time,
Yeah.
apart from anything else, but also it's just one person. And like you say, if they've had a bad day, they're going to have a completely different opinion on what's happened to somebody else. Yeah, you're absolutely right. So I think the key thing there is that dialogue and keeping it open and having those conversations. And like you said right at the beginning, you have those conversations across the system with your various different comms and your counterparts to keep that dialogue open. And I suppose we need to be doing more of that, but across the support services to clinical, that kind of bridge. And I know we're doing a bit more of that. We've got Emma Jackson in post, haven't we now, who is sort of a bridge between digital services and the sort of clinical world, making sure that that relationship is working really well. So I think things like that, I think, are really important. you definitely said this to me once. I remember this. The further you are from patients, the more you make assumptions. And I think that was a really interesting thing to say, because that it really made me reflect that it's very easy to say, well, I'd imagine patient X is thinking this, or I'd imagine clinician X wants this. And actually, sometimes it's not that. You could say that the biggest thing that we need to fix as an organization is this. But actually, if you talked to people, they might say, actually, do you know what? Yeah, that would be great if you could fix that. But there's an easier thing to fix that would, make a bigger difference, actually. Do you feel that about your team? Are there things that potentially, that if just one tiny thing could get done, then things would be different?
Yes, and I wonder sometimes it's not a thing, it's a way of being. I have found what people want most is to be heard, to have the opportunity to speak without being interrupted and really, really listened to. And you don't necessarily have to do anything as a manager after that, just demonstrating that you are willing and you care about them enough to listen to them. Generally, people know what they need. And just through listening, you can sometimes instill a level of confidence in someone that actually, I do know what I need, and I definitely need that, and I feel confident to go away and do that. So I suppose that's really good in a sense, because actually it isn't difficult, it isn't complicated. We don't need a really elongated and convoluted process to support people. We just need to listen and be present. Rather than having a conversation with someone, just come and sit in their environment and listen and pay attention. Because just through sitting in someone's environment and hearing and seeing what they're doing day in and day out gives you a greater idea, and you're not getting their perspective after the fact. You're experiencing it with them next to it when it's happening.
And you mentioned again at the beginning about culture, and I think that's exactly what you're saying. Listening to people is free, doesn't cost anything, and it's all about that culture. I was listening to a podcast. It was about people having a voice, but are people ready for what that invites? So, for example, when people say, oh, I've got an open door policy, you can come and see me anytime, and actually they're waiting for people to come, and that's not what we should be doing. We should be getting out there and inviting those conversations, because actually that open door policy, it's actually not that open, if that makes sense. It's people still have to physically come to you, whereas actually if you really want to hear what's going on, you go to them.
That's where we need to recognize how important psychological safety is and where people are at in terms of that. I know particularly with virtual working now, we've got sort of interactive forums and things like that, and we encourage people to put honest feedback on forums and things like that. And if people aren't using it, then there's obviously not a problem. And it's recognizing that actually maybe people aren't putting things on there because they don't feel safe to put something on there. And that feeling may be justified, but it may not be. Often people are frightened of the idea of something. They're worried that there'll be comeback from it, which is not true. It's never true, but people believe that. And I think it's through listening and understanding that actually people can then say, well, actually, I thought this would happen. And you can address that and support that person. And through being in someone's environment, you are not requiring them to, as you say, experience an incident and then think I need to go and talk to someone about this incident. I'm going to go and talk to someone about this incident. You've been there, you've observed that, you've witnessed that experience, and you are there in the moment for that person, whether it was positive or negative, to say, are you all right? Or, wow, that was really great. I really noticed how you handled that particularly well. And I think that's equally as important, giving people really clear, specific feedback when stuff has gone well, articulating the kind of behaviours that they demonstrated that were really positive, really helpful. But you have to be physically present in that moment to do that.
So in that 7 months, is there anything that you've introduced in terms of sort of feedback and positivity? Is there something that you've introduced with your team that they perhaps didn't have before, that other people could maybe share?
We now have a weekly NN3 newsletter. So we have the week in NN3. It's kind of a mixture of a briefing and I try and make it a bit personal. So good news about people, if we've got people who are new to the team, or, something significant has happened for an individual, and we try and put photos in it and make it a bit more, kind of humanize it a bit, rather than it being a bullet point list of these are the things you need to remember. I put on there about training opportunities and things like that, and just key things that people need to be aware of. So hopefully that's something that people are interested in reading, and I've had some feedback from staff that actually they enjoy reading it, and it makes them feel part of the team to have that kind of extra bit of information. I'm sure I've done other stuff but to be honest, 7 months in operations is like a blur. So much happens all the time. I can't quite believe it's been 7 months. It's been, like I say, it's been the most challenging but the most rewarding 7 months of my career.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.